Thank you for viewing our Medline slider today. We're going to show you some tips and some guidelines on how to properly use our friction reducing slider sheet. It's called a tube slide, reason being it has two sides and it slides onto itself to make it easier to transfer or reposition a patient. So what I really like about our MedSlide transfer sheet is that it has directions on the face of the MedSlider. So if you forget any of the instructions that we're going to provide you today, you can simply look on the sheet to refresh your memory on how to use it. So some quick little tips. The size of the slider is a perfect size to fit under a patient and under the largest part of the patient, which is their torso. So it fits under their shoulders to their hips. And that's where most of the weight is, so that makes it easier to slide them up or down or across. So there are directional arrows on the slide sheet to show you which direction to slide a patient. So for instance, if you were going to boost someone up in bed, you would lay the MedSlider in this position here because the arrows are pointing up and down. And then you would simply slide it back and forth to glide the patient up to the head of the bed or lower the patient down. If you wanted to transfer someone, you would then just turn the sheet and then again go in the direction of the arrows and slide back and forth.
In order to get the MedSlider under the patient, we're going to demonstrate a traditional log roll. So first I'm going to roll the MedSlider up a little bit so that I can slide it halfway under the patient. Next we're going to use our draw sheet and she's going to tilt the patient towards her. Slide it under. I'm dropping back. And now towards me.
And then I simply just unroll.
Okay. And now it's ready. Okay. In this next portion, I'm going to demonstrate how to get the MedSlider tube slider under the patient if you're unable to log roll them. So again, I'm going to have my other nurse hold this up. And then I'm going to push the MedSlider into the bed underneath the patient and keeping my hands between the patient and the patient's skin and the slider to reduce friction. So like so. And now she will
I'm going
onto
to lift, just go under and find the slider, which is right here, and then I simply pull through on the other side. Super easy, in case you can't log roll that patient.
So in this example, we're going to boost the patient up in bed. We've already applied the MedSlider, and you can see the arrows show the direction we're going to pull the patient. In this scenario, our patient has slid down in bed, so we need to boost him back up. Right now, the head of the bed is up, so we wouldn't want that. I'm going to flatten it so that we can reduce the workload on our back. And then we want to make sure that the bed is about our waist or hip level. So now myself and the fellow nurse are going to boost him up in bed using the MedSlider. Okay, here we go. 1, 2, 3.
So a couple of things we want you to note. The MedSlider is placed under the patient between his shoulders and hips. And again, the directional arrows are pointing across to the direction we're going to slide the patient to the other surface. Some safety features that we like to point out, or tips. One is that we want the aid of gravity to help us transfer the patient to the other surface. So this second bed is approximately 1/2 inch to 1 inch lower than the bed the patient is on. The other safety feature is that you always want to lock the casters, of course, on both the surfaces. Okay, so we're now going to show you how easily this is done. So our patient is lying in the bed. We have 2 nurses. Now please refer to your facility guidelines as to the proper number of assistants that's needed for this type of procedure. For this video, we're going to show 2 clinicians. So we're going to laterally transfer the patient from one surface to another on the count of 3. 1, 2, 3.
questions regarding the MedSlider or any other Medline Safe Patient Handling products, please reach out to your Medline representative. Thank you.